Now more than ever, research sponsors and investigators around the world are increasingly aware of and sensitive to the disparities in access to research and the lack of representation of diverse stakeholders in the research studies that are running today. We certainly saw incredible efforts during the vaccine trials during COVID, and the opportunity now is for us to be able to sustain those changes beyond the pandemic. We're seeing that embodied by improving diversity of investigators. We're seeing it being embodied with more thoughtful recruitment efforts. We're seeing it being embodied by making sure that when engaging with patients for input around the design of our studies, that those patients themselves are diverse. We're seeing it embodied by activating research sites in more creative and fresh locations like federally qualified health centers in the US. And we're seeing it embodied through efforts like decentralization that can enable participation agnostic to location and the barriers that travel represent for so many individuals.
It's important that I think we spend time addressing, identifying, but then taking action, because I would tell you in a lot of communities who have historically been sidelined or historically overlooked, they have heard us say this over and over. We're going to look, we're going to study. What they haven't seen us do is show up later and give the results and take action. That's what's missing. And that's what I hope the next 10 years, the future would show us, is no more just data collection, is how do we take action?
We need to be really clear about what our goals are, identify how we can meet them, and then measure. I mean, we always talk about what gets measured gets managed. So, okay, well, what is the measure? What is the measurement? And I think that we need to operationalize the value of equality, at the board level, at the management level, have it be part of HR and integrating, okay, how are we identifying, what our metrics are, where do we want to get, how inclusive do we want to be, what does diversity mean to us, and how will we show the results, we have something to be accountable to.
As a woman of color, I really think it's important that women's health is brought to the top of healthcare. And what we're seeing over the last few years is that there is an uptick in innovation and technology that is specifically devoted to women and their health, whether that's with mental wellness, whether that's with their reproductive health, and also for women going through menopause. So what we're seeing is that there is going to be a shift in how we approach women, how we actually look at the conditions that are impacting their quality of life, and we are going to see women optimizing their health and their care over time.
Data is extremely important for us. It is how we segment, how we understand, how we target our population. Women's and children's oncology indications are often overlooked, which represents a clear unmet need for us and an opportunity to address these underserved markets and bring products to market that will have a significant clinical impact.
Behavioral health is something that can be delivered easily and very accessibly in a virtual way. I've heard a lot of very different organizations talk about how that was something they've adopted over the last year and a half, and they've really seen it stick. And I think that helps to make it more accessible, whether it's people who live far away or people who might otherwise sort of face a stigma to going to see a behavioral health provider. So I'm glad to see that getting a lot of attention, and glad to see a lot of organizations beginning to embrace that.
The future of clinical trials is one that's highly democratized and accessible. The future of clinical trials is one where patients aren't siloed to either be a research subject or receiving care, but where this bridges. The future of clinical research is one where participation is ubiquitous, wherever you're receiving care, with the ability to share data on your own terms to support the research that's right for you. The future of clinical research is truly patient-centric in that patients are deciding where and how their data is being shared.
The future, I think, is in bringing together the traditional systems of record with new systems of information that exist outside the clinical setting. So social determinants of health data is a really important component to the future of how we pay for things and how we make sure that people are receiving the right care. And so when I talk about bringing together clinical data and business data and real world data and banking data all into kind of one conversation, that has everything to do with access, because it enables us to think more holistically about community information exchange, using social determinants data as a real tool in how we access and pay for care. And I think that, has some challenges to it, but it also has a lot of opportunities if we do it correctly.
Particularly here in the United States, it is a very, very complex environment of delivery of healthcare with so many different players in the market. So I'm looking at it from a pragmatic perspective to say, which pieces can we use to change the way we do things? For example, can we use data to really make informed decisions to help people live better from their wearables and their connected devices? Can the Walmarts and the Walgreens of this world change their model to deliver care to those remote parts of the country that don't have a GP, for example? Can the pharmacists do it digitally using telemedicine? So those are the kinds of things I'm really excited about in learning and seeing how that kind of thing will transform the delivery of care for all of the people that need it.